Good day, hello and welcome. My name is Dr. Shamim Badania. I'm from the Leadership Dialogue. Welcome to our second webinar on the COVID-19 simulator for the public, CoSimPub. In this webinar, I'm going to focus on using the simulation interface. Just to recap, the purpose of CoSimPub was to create a model for the public so that the public could get an understanding of the key dynamics. The underlying model, one may be able to calibrate it for different settings and contexts. If we had the relevant data, the model could be used in many different contexts. In the previous webinar, I focused on the actual underlying system dynamics model itself, so please do have a look at that webinar. Today, I want to focus on the actual simulation interface that the user will be focusing on to give you a sense of the look and feel. You can get a sense of the dashboard. Using the interface, one can then run the model under different scenarios. In this webinar, I'm not going to go through any particular scenarios, and the scenarios will enable one to assess the impact of different strategies. We will do that in a future webinar. So just to give you a sense, this is a screenshot of the user interface of the CoSimPub COVID-19 simulator. I'll now go into the actual interface itself and just give you a brief description of the different components of the dashboard on the interface panel. So here on the left, this is the user input panel, and this is where one would be able to enter the different variables, the values for the different variables. Here we have a number of dials, so these are also input devices, and I'll talk through some of them in a little while. Here we have an output panel in terms of giving a sense of the different numbers of people in the different categories as the infection spreads through a population. And we have 3 tabs of graphs. So if one clicks on the tabs, you'll get the different graphs. And here's the actual control panel buttons. It's fairly self-explanatory, but I'll just walk you through very briefly. So let's just walk through this. Here's the run button. So if you run that, it'll give you a simulation run for the current input values. One can then, for example, play around with the dials and then run the simulation again to look at the impacts. So if you change any of the inputs, either on these input devices here or specific values, so for example, contacts per asymptomatic, if I increase that to 5, I can then run the simulation again and one can see the impacts. You can always reset the simulation to the default values and run the simulation, and you're back to where we started. Here's a button that takes you to give you a high-level view of the actual stock flow map of the system dynamics model. And as indicated in the other seminar, we go through that in some detail. So we can return to the simulator there, and let me now walk you through the input panel. So here's the initial population. So one could use this simulator for any given initial population. So if we were South Africa, we would probably be looking at 55 million. You can apply it at different units of analyses at provincial levels, different country levels, etc. The contacts per asymptomatic, so that represents the number of contacts per day by each person that is infected but is not yet showing symptoms. That's included in that are also the contacts with surfaces. The probability of transmission on each asymptomatic contact, so that represents the likelihood of the infection being passed when there is a contact with an asymptomatic individual. Then we have a similar set of inputs for individuals that are infected and are already showing symptoms. So that's contacts per symptomatic per day and the probability of transmission on each symptomatic contact. So these represent contacts per day. The incubation period represents the number of days that the virus is in the body, and when somebody is asymptomatic before it manifests itself in terms of the symptoms. Recovery time represents the number of days when a person is infected and is symptomatic, and the number of days before they recover. And this is recovery time when the person does not need to be hospitalized. The vulnerable percentage represents that proportion of the population proportion of the population that are infected that would require hospitalization. The ultra vulnerable represents that proportion of the population that are infected and symptomatic and who require hospitalization but do not have the opportunity for hospitalization. And the hospital recovery time is the average time in days once somebody is admitted to hospital for them to recover. If you look at the underlying model itself, that you would notice that the pathway to hospitals, there's a recovery pathway, but there's also some deaths from patients in hospitals. There is a proportion that would also die while being in hospital. The quality of in-hospital care is an index from 1 to 10, 10 representing a very high quality of in-hospital care, and 1 representing a very poor quality of in-hospital care, and that impacts the recovery rates and the number of people that would die in hospital. The percentage ICU capacity is the percentage of ICU beds in relation to the total population. So hence you see it's a very small number. So one would look at your context and identify the number of ICU beds available for the total population that you have here in your initial population. The way the simulation works is in the default setting as it stands now, it does not take into account any capacity constraints. So it assumes that anybody that needs hospitalization and needs ICU care will have it. If one turns the switch, then it now builds in the capacity constraint, and that will obviously mean that not everybody who requires ICU capacity, ICU beds will have that available, and that will naturally have deleterious effects. The way the model is set up is that, as indicated in another webinar, the science is not clear yet in terms of whether once a patient has been infected and has recovered, whether they now become immune to COVID-19 or whether it's possible for them to become infected and ill again. And the model allows one, the default setting is that there is full immunity, but one could model different levels of losing immunity. Here, this represents the number of patients, of people in each of the categories. So the healthy people, and then as they pass through the different stocks in the system dynamics model, in the stock flow map, it represents, here you have the absolute numbers, and here you have the percentage in relation to the total population. So one can get a sense of how many people are asymptomatic, how many people are symptomatic and infected, the number of people currently hospitalized, those that have recovered, the number that have now become immune, depending on the level of losing immunity, and the number of deaths. And that represents here is the percentages. In terms of the graphs, so let me run the simulation now just to give you a sense. So here in CoSimPub, you see each of these categories. You can now see how the infection spreads. If you move your cursor along, you'll see, for example, at the bottom, let's stop here. This is day 23, and you can see the number of people in each of the different stocks, in each of the different categories. And obviously, you'll see that in this particular case, with these settings, the entire population will eventually become infected. They're symptomatic, they become asymptomatic, they then become symptomatic, and then some of them would recover, some are hospitalized, and some will die. And here in 6 months from now, you'll get the final numbers in each of those categories. So this shows the full disaggregated stock flow map, the number of people in each of the different categories. and you can then just slide your cursor along, and you can look at the impacts on as time passes. Here we have the infection spread in terms of daily infections. So that's the blue line. So the number of infections each day, and in this case, you can see within 14 days, the number of infections have peaked, and then it starts dropping after that. So very early on, within 2 weeks, the rate of infections have peaked in this particular set of parameters that's currently on this input panel. And then the red graph shows the cumulative infections. And so here you're essentially seeing that everybody becomes infected given these high levels of contacts and probabilities. The totals, the tab on totals, just sums up the total number of infected and shows the deaths and the total recoveries. So here you can see in 180 days, in 6 months, you've had 989 recoveries and 11 deaths. So we had about the death rate over the time period was just over 1%. I'm not going to run particular scenarios, but just to give you a sense of how you might see some shifts. So let's, for example, raise the contacts per asymptomatic and to 10 and run the simulation, and you'll see what happens there. You can see that the peak happens in 6 days as opposed to 14 days. And that makes sense given the higher number of contacts. There's a much faster spread in terms of infections. And obviously one could then follow that same logic in the breakdowns of different categories. Let me reset the simulation and then just explain these two buttons for you. Go live enables you to immediately see the impacts of any changes you make in the input devices without having to press the run simulation button again. So for example, let's do contacts per symptomatic, and let's make that 10 contacts per day. And if I go tab, you will immediately see the change. Let's increase, let's go to the totals, and let me reset the simulation and then go live and reset the simulation and run the simulation, and then I'm going to go live. And I'm going to change the probabilities of transmission to 0.8, which is a very high probability. And you can see what happens. The entire curve is shifted to the left. And here now, within a matter of 4 days, everybody's infected. Obviously, that's a very, very high probability of transmission. The real likelihood of that, one would have to look at your specific case, but that's a very, very high probability of transmission, and it's probably unlikely. So let's reset the simulation to default values. I'm going to run the simulation to get to our default pattern, and I would like to change the recovery time to a much longer time, and let's go live and see what happens there. So let's go back to recovery time to be 10, so you can see the differences, and you see what happens as you change the recovery time. Notice the blue curve, how it changes. Let's go to the breakdown so you can see it more vividly. Let's make the recovery time so it's a much longer time for patients to recover, and you'll see that that has quite an impact on the hospitalization curve as well. Let's now increase the vulnerable percentage to 4, and you start to see the impacts. All right, so I think that gives you a sense of being able to use the dashboard itself. You can play with the tabs, you can try a number of experiments for yourself, and in a future webinar, we shall actually go through using the simulator with a number of different scenarios to be able to see the impacts of different strategies. And what you will notice is that when we're looking at, if you want to explore things like social distancing and lockdowns, we are essentially going to be changing these parameters of contacts per asymptomatic. So it's the number of contacts and it's the probability of transmission. And if we want to get a sense of R0, the reproductive rate, it's a combination of the contacts and the probabilities and the recovery time and the incubation time. All right, thank you very much and hope to see you next time. And if you found this useful, then please share it with your colleagues. Thank you very much and see you next time. Bye.